All right, I'm going to show you how to anonymize in Anatomage Invivo and then create a file that can be viewed from any computer, even if someone doesn't have the software to view cone beam CTs. This file that you're going to create can be opened up really from pretty much any computer at this point. And then how to view that file from that executable file that we're going to create. Now this is not the way I prefer. I prefer just the regular dicom images, then I can view things with my own software. But first step, I said I would show you how to anonymize. Go up here to File and then Case Info. Anonymize is right here. You can see I already anonymized the patient, but it'll ask you if you want to proceed. Yes, and then it gets rid of all the patient information. No identifiers here. That's important for if you are transferring in a way that's not secure. It can be shared with anyone because now this is non-identifiable. So that's anonymized. To save, let me first show you this. If you want to save as dicom, go to Save As. You can do either single file dicom or multi-file. Either one will work. Easiest is probably the single file one. Invivo is a proprietary one, which that's the software I use for if you're sending to oral radiology, that's a fine one to use. But either of those really will work. So anyway, to create that file that can be opened by anyone, even someone that doesn't have the software, go back up here to File, and they call it lay egg, which I think is kind of clever, easy way to remember. So lay an egg, that's creating an executable file that has a really trimmed down version of the software that's just kind of minimal for viewing the cone beam CT. And so you save it, you name it whatever you want. Say I'm saving it as a case. Various cases here, so just change the number. Tell it full. And then it does take a few moments. And there you go, file saved successfully, and it will tell you the egg also has been successfully created. That's that software package where everything's wrapped into a single file that someone can just open up. And so this is what the file will look like. It just says it's an application. It is called a single case viewer file. So if you double click that, that should start opening up. And it even gives you this warning. Yeah, you're not getting the full version of the software, not used for diagnosis. You do get the entire cone beam CT volume, you're just not getting the dicom image. And the software that this comes with is, like I said, really trimmed down, just minimal to view through the case. In a pinch, I can interpret a cone beam CT from this. It's just not ideal. I like having my own software where I have all the different methods of looking at the image. I have the TMJ view, you have implant planning. You see none of that is here. You have the section view, and so that's just your typical multiplanar reformat with your axial here, your sagittal, your coronal. And so you can scroll through by grabbing this right in the middle. Notice I turned this off. This is the view by default. These cross sections show you where you're viewing in the other views. This is where you're viewing in the sagittal is this green bar. The axial plane here is going to be the orange bar, and the coronal plane shows up as kind of purple, it looks like here. And I like to use a free fly mouse wheel, but right now the interval is only 0.1 millimeter, so I'm going to turn that up to about 0.5, and it goes a little bit faster. Still not too much where it feels like I'm skipping things. If you do, let's do 12.5, and that you're really not able to see enough, right? So you don't want to turn that up too much. 0.5 is probably the maximum you want to do. Click the little toggle cursor visibility right there to remove the bars from most of the screen. And so that's your MPR view, just real quick. This one just changes the orientation of the 3D view. If you look in that bottom right corner, change it to the right. Or you can just click here and drag around. But you're not going to spend too much time looking and diagnosing from this because you obviously can't see so much. Despite what vendors may tell you, no one's diagnosing from the 3D view. You've really got to look through all hundreds of slices of this to get a good idea of what's going on. Then I'll show you the arch section here. So this is the curved section, where by default it kind of creates a curve. If you want to create it yourself, go ahead and click on this reorientation button. And you can either just click and drag these around to more closely follow the curve of the teeth. First thing I always do though is I look at the orientation over here, and I make sure the occlusal plane is pretty flat, and I also make sure the maxillary mandibular teeth are somewhat vertically oriented. So if they have flared incisors, you need to kind of hedge the difference between the maxillary and the mandibular and have those as vertically oriented as possible. And then change over here. This is kind of your volume that's being captured. So slide those green bars. You can see that really changed where this lines up. If you want to create an all new curve and not just drag these points around, then this button right here to create arch spline, create new. And then just kind of follow the curve of the teeth around. I might go back and adjust that a little bit. I'm just doing it really quickly here. Right click when I'm done, and it gets rid of that. Line that up a little bit better. I like to widen it, make sure you get all of the roots of the teeth so everything's captured in what we're going to view. And we're capturing all the mandible here, so that's good. This to turn off the name. This again turns off the crosshairs. Click this when you're done orienting it. If you want to get a panoramic view, you can just double click on the cross section here. Let's get rid of those crosshairs again, and then hit X-ray over here on the side. That'll always bring up this ruler. Typically I don't want to see that ruler. Brightness and contrast is always here. So most of this is just the same, even if you're using Invivo software, if you're using TxStudio software, it's just going to look a little bit differently. A lot more options with Invivo and with TxStudio. Once you're happy with your brightness and contrast, in any view, this is going to be the same. So if you control click and drag the left mouse up and down, that enlarges the view. If you hold down the shift key and click, you can move this around bodily. So get that lined up where you want. It doesn't have the file, it doesn't have all the menu options in this little egg viewer that we have. But if you do want to save to gallery, just hit Control G. And that'll give you the option. Do you want the whole image showing all 4 of these or just one of the views? You can select one of the views. The volume view is there. Let me go back to arch slice here. So same thing here. I do Control G, and that will capture to gallery the pano. You could rename it if you want, panoramic, type whatever you want here. And then that should show up in the gallery here. Yep, there it is. You can export that to your computer. I have it saved by default to my screenshot folder. But going back to here, now I want to get out of the pano view. What do I do? Well, over here was the X-ray view. Now just go to slice. Anytime you want to enlarge a view, you double click it. I don't think I said that before. So double click this, and now it shrinks it back down. So now you're wondering, how do I get, I don't like these 3 cross-section images right here. I just want one here. I want a larger arch view. And that you've got to click this button either right here, layout, or there's a change layout button over there. This is the one I typically use for looking through my CBCTs when I'm looking at the dentition. I've told my students I spend a lot of time looking at this because dental disease is so common. I'm going to enlarge this. And so my maxillary teeth occupy most of that screen right there. It's nice and enlarged. I have a big screen and I can see everything. Scroll from the buccal into the palatal. And you can see I clicked right here on this vertical section, which is the curved slice that I'm looking at right now. I'm no longer looking at a panoramic reformat. I'm looking at the curved slice going from the buccal to the palatal. And what do you see? I'm not going to go through diagnosing right now. I'm just showing how to use the software. But get a good look at everything throughout the maxilla. And you're interpreting the maxilla. All the dental disease, periapical lesions, cervical lesions you can see. Sometimes you can see caries, although this patient has a lot of restorations. And it's going to be really difficult to see any amount of caries. Any dense material creates a dark artifact line around it. If you see this line streaking right here, that's all artifact. But you can see the apices pretty well. I can see an extraction site with what looks like bone graft. So look through all the mandible. Then I'll also spend a little bit of time looking in the axial slice. This is where it seems like I capture a lot of time when there's calcific metamorphosis and one of the canals is completely calcified. So you do look through all slices. You also look through this cross-sectional slice. That's a good one for catching when there are buccal or palatal cervical lesions. In this case, I just see metal artifact, so I can't say whether there's a recurrent carious lesion there. Or in patient without as large of restorations, you can see non-carious cervical lesions. Those stand out pretty well in a CBCT, probably often overlooked. There's a lot you can see. And so that was just a quick rundown of how to use the software. This is called the Egg Viewer, the built-in viewing software that you can get with Invivo from Anatomage, or TxStudio, which is basically the same software, just packaged up for iCat. I hope you enjoyed this, if this was something you were looking for, and I'll see you next time.